Happy spring. Today is, I guess, the spring equinox, as Naila was telling me. It's an equal day of light
Equal day,
and dark.
equinox,
Yeah.
Latin.
So it's a good day to talk about our health. And March is also Women's Health Month as well. So I wanted to do this workshop with my colleagues, Naila and Dr. Rafiq from Nirvana Integrative Medicine and Shakira Wellness Collaborative. So we'll get started. So this is going to be a different format. We encourage everyone to participate. Feel free to ask questions while we're presenting. We want to have an open dialogue and a discussion about the topics. So just a little bit about me. My name is Myrna Simal. I am a research scientist and a holistic nutrition and a health and wellness life coach. I've been in science for over 25 years, and I also recently, the last few years, been working in my holistic business as a nutritionist to focus on prevention and help people live healthier lives. So it's just practicing the principles of natural healing. First, do no harm, and harness the healing power of nature, identify the cause, treat the whole person, not just the symptom, to educate and ultimately prevention. So today I'm going to focus on just a few key points on women's health and nutrition aspect. So Dr. Rafiq is going to focus on some of the major health issues women face, especially now in the time of COVID. And Naila is going to talk about mental health and stress. So just some key factors and some background. So one in four women are dissatisfied with their overall health and wellness. Like we're all wearing many hats and we have many demands in our lives. And sometimes we forget to take care of ourselves. So today we wanted to focus and bring to our attention like some of the things we need to do to take care of us because we take care of everyone else as women. So some of the health issues that are common for both men and women, but women are affected differently because we have different hormones and different stress factors. And according to the NIH, women are more likely to suffer from alcohol abuse. We have a higher risk of heart disease. We have more mental health um, issues and risks. We suffer from bone loss. We have higher risks of STDs, UTIs, stress, and stroke. So it's important that we take care of ourselves. So in terms of nutrition, you know, during the lifespan of females, we go through different stages and we have different hormones and we have different nutritional needs. So as we grow through teenage to later on life, we have increased needs for calcium, magnesium, vitamin D, iron. Those are like some of the main factors and nutrients that we need, folic acid as well. Um, So the daily requirement for calcium, and calcium goes with magnesium to help with bone structure. So depending on your age range, women a daily intake should be 1,000 to 1,200 milligrams per day. Magnesium helps with stress and sleep. Sleep is also important. So we should get between 320 to 400 milligrams a day. And vitamin D is very important. A large majority of women, and I guess the population in general, have a vitamin D loss, and especially now with the pandemic and COVID, we've been inside more, so we'll see higher, um, cases of vitamin D loss. And Dr. Rafiq could touch base more on this, like the stuff that she sees in the clinic. And also iron is very important. When we go through puberty to midlife, through menstruation, our body requires more iron, that you lose more iron over time. And then, you have fatigue, and that will affect your bone, your overall metabolism. So it's very important to keep track of our nutritional needs. And some of the top diet and nutrition tips I could provide with you today is like focus on the whole plant-based foods. So lots of fruits, leafy green vegetables, whole grains, beans, as I mentioned, calcium for your bone. And then watch your protein intake. So protein is essential, but if you have too much, it gets stored as fat, glycogen in the body. And as I mentioned again, iron is essential. It's one of the most important minerals that we need. And we should also cut back on the amount of caffeine and alcohol intake. So, and I know I'm guilty as charged. I drink a lot of coffee just to keep keep going.
I enjoy
So
a cup of Java.
sorry.
I enjoy a cup of Java also.
Yeah, everything in moderation, right?
Yes.
So, the vitamin, the B complex are also essential. So, just to highlight vitamin B, vitamin B12 is also important, and all the essential nutrients are important. So, if you have any questions, feel free to ask me. Like I said, I just wanted to give like a preview of this and have more of an open discussion, and we could continue on. So I introduced Dr. Rafiq. She is the founder of Integrative Medicine. Dr. Rafiq, welcome.
Thank you, Myrna. Thank you for hosting this wonderful, focused conversation on women's health. I think it's not only the spring equinox and a time of equal day and night, but it's also a time of balance, right? Finding balance and doing that spring reset. And I think more than ever with us recovering, we're going through this recovering from a very large pandemic. As you said, in general, women are disproportionately affected with health issues based on many socioeconomic issues and social disruption and food insecurity, isolation, and so many other social determinants of health, which have been really compounded during this pandemic, including raising children while working from home, which has been the biggest disruption, and also a major setback in the advancement of women, where many also had chosen, because of the large task at hand, that they left the workforce to raise and rear their children, as childcare is such a major issue that's still unresolved. So I think this Women's Health and History Month, a lot of things have come into focus for women on these issues. But, in particular, what you said is very true, including a recent study they did during the pandemic, looking at women and men disproportionately affected by the health issues. It was clearly seen also how the stress affected women really had an impact on their hormones and their health because of the stress hormone cortisol. Our entire health and life cycle is really based on more of our hormonal balance, which starts early in life, from menarche into reproductive age, into menopause. And our bodies are very dynamic. Women have so many health issues that really kind of rise and cascade with hormone balance as a main issue. And as during this pandemic, we've seen it more than it's shared, that certain types of hormonal conditions have really come to the forefront. Even with the disruption, most of us know that there are certain screening measures we do for women's health, especially mammograms and yearly PAPs, PAP screening, cervical cancer screening in general. And a lot of those preventive health measures were also disrupted. I had seen tremendous growth of breast tumors to the sites that you normally don't see in a growth phase. And again, that makes me concerned that the hormones were extremely triggered by the fear and the anxiety of the pandemic, but also because women were shown in a study to have disruptive eating patterns related more to emotional eating. dealing with the burden, as we discussed, of being the primary caregivers for many of their elderly parents, as well as their young children or grandchildren. Many situations arise where women still, are the caregivers even for their children's children. And, at midpoint of their life, where they're also then like leaving their reproductive age and going into a very stressful perimenopause. And perimenopause in itself has a cascade of the hormones, as estrogen and progesterone are now plummeting. And there's a definite need to have balance during that time. And I find that especially with certain age, that's a time to replenish and, restore and, find integrity in their day-to-day balance of stress and how it impacts the hormones. So they did, I believe, a study in the nutrition magazine that they just unleashed. And it's absolutely clear that even though the men and women were exposed to the same level of stress, the impact on health was much far greater for women. And that really has resonated for us now, seeing that women are bearing the brunt of so many health epidemics beyond caring for people that are sick during the pandemic, as well, and being more exposed. So hormone health is a real big issue. Fibroids have been growing. So these are all pretty much like a hormonal stimulation of estrogen. And estrogen gets triggered and stored as fat in the body as well, right? So any kind of excess weight gain, which we've seen large increases in obesity. There are very few people that have told me that they've come out of the pandemic without the pandemic 20, or I don't know, they're calling it 15, 20, depending on how many pounds you're putting on. But my biggest concern is a lot of it is that central obesity, as we see that disproportionately belly fat is a indication of stress hormone accentuation. And then many people with metabolic conditions like pre-diabetes are now kind of transitioning into a diabetic state. And it's definitely a stress response on top of eating and not exercising or being kind of locked up, not being able to move, the lack of movement and motion, and a lack of the ability to really kind of channel that stress in a way that's healthy. So most people that have find and harness a way to kind of transition that energy is really what has been sustaining for them during this pandemic. The cortisol release through the stress response, which is that fight or flight response, disproportionately also kind of affects heart rate and affects emotional state. Also the lack of any kind of long-term care with specialists right now, like many women that, we forget that heart disease is the #1 killer of women. And many women have elevated blood pressure. And it's also something I'm seeing quite a lot. We've done a lot of remote patient monitoring, which has, I think, really been very critical, that maybe life is going to change after this pandemic, where we will need to use wearables, like tech wearables. Home monitoring of blood pressure and heart rate are going to hopefully be standards of care to help manage patients virtually, because I think this is not going to change in generations to come. So what is really critical is that the hypertension itself, when it's uncontrolled, can create such damage. And, it all comes from that stress response, as well as like palpitations, irregular heart rate. So hypertension in itself, we've been seeing so much of that, and starting people and remotely monitoring and trying to manage. But a lot of it, I think, is really from that stress response. As I discussed earlier, that heart disease is probably the #1 killer. So along with hypertension, a component of that is healthy eating and lifestyle. And I'm glad you mentioned a plant-based diet, because, I think when it came to emotional eating and craving, it was more starch and, high fat diets, and to some extent cholesterol has really been a marker for heart disease. And along with having pre-diabetes, hypertension, if your cholesterol levels have gone up as well, which is often the LDL cholesterol and triglycerides, which are a marker of, starch, starch metabolism as a fatty liver. We see some of that early on in diabetics. There's been a trend toward that kind of elevation too. So it's almost like a year of managing patients that everybody has to kind of have a big reset now, because all of these issues have really combined in increasing risk factors, such fatal conditions for women, and women heart health is so important. So I think as also being someone who's seen so many patients who are older women or younger women affected by COVID-19 is very scarring to the lungs, and the fibrosis is sometimes seen substantially months after they've had active infection. So we've had to screen lungs and make sure that women that have never had asthma or any kind of lung disease still after COVID have substantial scarring and need to have follow-up and proper assessment. The pneumonia piece is usually where we see that. So if somebody's been actively admitted for pneumonia, it's more common. If they had a very mild upper respiratory case, not so much. But there were very interesting challenges of COVID-19 because there were some neurologic effects to women's brain in a sense of neurologic issues like mini strokes. There were some blood clot issues, vascular changes. And so it was not very predictable. And I think that's what's very challenging with this virus as it continues to mutate and change. We have had to be at least many steps ahead, and we still are not catching up. And I think it's hard for the public because all of that quick changing science and really trusting the science and, kind of adapting their lifestyle and seeing where their risks are is really like a inventory that every woman needs to make with their selves and their health issues. So this is a good time for them to focus on those changes. And then in addition, even if you did not have COVID, but had just the experience of, being through this pandemic, how trivial. I mean, I think sometimes it was a relative loss. I mean, we had people that have lost people that have been grieving collectively, lost several members of their family. I lost a very personal friend. It really just, was accumulating grief. And that emotional resilience has been really something that beyond the physical, how do we emotionally cope with that is a tremendous detriment to women in particular, because they're not only emotionally needing to be the stable, matriarch of their families, but they also have to emotionally manage the well-being of their children and their parents, especially the elderly high-risk parents that were particularly, at risk for death and dying, and they dealt with that as well. This grief is one big issue I feel that people have not really spoke about on a larger perspective, but it is being studied because we won't know till years later how this has kind of created almost like a post-traumatic stress in our lives, and also how the brain has really adapted. So COVID-19 in itself and just the pandemic, being wrapped into this pandemic mind, all the shifts and all this, there's really clearly been through this Brain Awareness Week, apparently, we have been really discussing that there is this brain fog and where does it come from? And also how much of that fear itself, not necessarily the response in the body, which would be anxiety, but the fear mode that people have been responding to really stimulates the amygdala in the brain and the limbic system. And that amygdala and limbic system is very crucial in the emotional resilience. And, in some ways, it has impacted the hippocampus, which is the center of memory. And in many, many models of patients, in other studies, if we adapt, we won't know until maybe other long-term studies are done. But there is real knowledge that, with chronic stress, the hippocampus, which manages memory and response to memory, will often shrink. People's telomeres will shorten, which tells us about lifespan. I think we already know some of those statistics in certain health disparities between different ethnicities that I think African Americans and Hispanics in particular during this crisis have lost years of lifespan. And so these are critical factors that have really shaped the mindset of women. And it's a lot to carry. And, I think, it's nice to have people engage in other ways to blow off their emotional stress in a way that's going to reset that stress response. And I often feel mindfulness and breath work are really great strategies. And I'm sure that Naila, who's really just such an expert in this field, should really guide us in how women can adapt their mindset to deal with the emotional effects and mental health stressors that the pandemic has posed as well.
Yeah.
So,
Thank you, Dr. Rafiq. That was very informative. You covered
Very
a
much.
lot,
I took
a lot
notes.
of the topics. Yeah. Well, we're recording it, so if anyone wants a copy of the recording, you let me know.
I took some notes just to kind of to respond and have a conversation, with you
Yeah.
all about some of the things, because there's so much.
there's
Yeah.
so much.
It's there. There's so much happening right now all around us, but mental health cannot wait. Mental health is really urgent. Long before we even heard of COVID-19, we had caregivers and workers, under the strain of working full time, providing care. They would go to work and come home, take care of their children, maybe run to a nursing home, to see their parents or grandparents, or even at home and relieve the caregiver so they can take care of them. It was round the clock. I'm not excluding men. A lot of men were helpful to their wives, but again, we're talking about women, cortisones, and and hormones, which men are. That's a frightening topic for them. We could do a whole nother conversation about that. But right now, they are looking at how this COVID-19 brain is affecting the 53 million caregivers in the United States, because it has been COVID-19 has been thrust upon us. It's not something that some of us have, or that there's a gene, that this is, the reason why this is happening. So it's a challenging time, for, all of us. And, we don't like change. And so to have it imposed upon us in such a way, there was a point where we thought, oh, coronavirus. Oh, this is going to go. Some people just taking pictures of the can of Lysol and saying, all you got to do is get this. And, then Lysol sold out, but that was clearly not the answer, right? And it became sort of the thing. Then we realized that this is going on for months, and then things start shutting down, and that's trauma. That's trauma. So 5 or 6 months later, here we are now, a year later, pretty much we closed the office last March, and we thought we would get back to some sort of norm, but we don't know what that looks like, and it looks different for everyone because everyone's been experiencing this trauma and transition. So in the mental health world, a lot of people have been feeling anxious, and they've been struggling to cope, and because they're struggling, they feel as though, oh my God, am I suffering from depression, anxiety? Well, you may be suffering from a mixture of things. However, struggling with this is not abnormal. So a lot of people have been diagnosing themselves and reading stuff and buying things from the health food store and everything. But like you said, Myrna, they have ignored so much of the good nutrition, and the vitamins and nutrients that they need to have it. It takes work to have a healthy brain. You're not going to have a healthy brain off a Snickers bar. Oh, that's the saddest thing. So that's not going to happen. Or my muffin, which I have, given up.
Those things are comfort food, like Dr. Rafiq was talking about. We go towards the things that we feel like will help make us feel comfortable, but they're not, and then they trigger all these responses in the body, like Dr. Freak was mentioning,
Right,
hypertension, cholesterol, the
right,
fatty liver. Yes.
right. And that affects brain health. It affects mental health. It affects sleep health. And if you're not sleeping,
Oh,
there's no healing
yeah,
happening. You
that's a
know,
big one.
yeah,
That's
sleep
a big
is a
one. The
topic.
insomnia was horrific. Yeah. For a lot of us, I think that sleep response was escalated. And I think
Yes,
I'm kind of in a perimenopause phase myself. And I initially assumed it was that, and it wasn't that. I think it's really been the pandemic or
right.
Netflix streaming and binging, which is a new norm.
Yeah.
People have been Netflix binging to the point that they've written articles about it, and people have been investing in Netflix. The shares have gone up substantially, with these type of things. So, we, it just seems to me, I think it's ironic that here we are going through a pandemic in a time where we have Netflix, we have health and fitness apps, we have ways that we can connect. My mom is going to be 103 this month. And during the pandemic, the stress of not being able, one day you can go see it, the next day you can't see it for 14 days because things change so quickly. That in itself is very traumatic, for everyone dealing with that situation. Or you can't go visit your grandkids, you can't get a hug. And there's trauma wearing a mask. So we've looked at some of the children who can't see a smile, and that's been very traumatizing to them. So what we've done with the children, Nick Ortner did a clip on it, you can usually probably find on YouTube, was they had the children when they were in the classroom tapping. So tapping is EFT, emotional freedom technique, and it taps on stress points in the chakra. Maybe we can do around before, I get through here.
That's good.
We talk a little bit more about, some tools that, that can help us, and always the breath. But who's been taking a breath through the pandemic? So people have been breathing at the same level of trauma, which is shallow. You find yourself holding your breath because of the trauma. So our brains, they do change in this type of transition, and it's a hard lesson for the brain. It's hard for the mind. It's hard to process. So thank God we do have technology where we can speak to people. And my mother at 100 learned how to got her iPhone. Best thing I can do. People thought I was crazy, but she will FaceTime me. So that's been a blessing, because it's really, really hard. And it's we're not 100% today. We're still, finding our way, looking for the best things that we can do, and the kind of perspective that can bring us into some type of balance, and focus. So people are I really have a lot of patients that are teachers, and here the teachers are at home teaching, and at the same time trying to control the children because they're at home and they're running. And even in my sessions, which we've broken all the boundary rules now, because we're on we're on video, so I can see the children are running across, and they're saying hello, and the parents are trying to focus, and tell their stories, talk about their anxiety. Even my cat jumped into the scene. Okay, so there's a lot. We're in the office, no one sees our private lives, right? But here we are, right? So I feel for the caregivers. I give for the for the moms, the workers, the people who are caregiving, who normally not their job, teachers who are teaching kids on screen and trying to teach their kids at home, as well. All of this adds to the stress hormones, and Myrna, a lot of call outs. What is that company that delivers? There's a Grubhub and all of those. They're very busy because people are so stressed out. They're forgetting to eat because this is a new dynamic. So they're calling out and having a lot of food delivered, but not necessarily health foods. And those who are eating healthy, bravo, good for you. Great. Unfortunate, because we like to cook around here. So we like to, have some fresh foods. But it is clearly an unprecedented time in history. We've never gone through this, before. So some of the did you say something?
No, someone came on and I guess we heard their background. Actually, just
Oh.
what you were talking about is one
We
of
were
our
just talking
guests,
about it, yeah.
one of our guests, they had their child in the background.
Oh, yeah, see,
Normal.
and this is what I've met so many beautiful children, dogs, and cats. Uh, and it's almost like they know what time we're going to be on. So they give me a little woof woof or meow meow. And the kids, come on and say hello. So some of the things that I've always enjoyed doing before the pandemic, I am a Reiki master and I teach Reiki, and I'm just getting myself together to do this online because I just never had the concept. We are doing so many things that we normally do, but now we're doing online. And for me, it does feel a little strange still because I'm used to having that energy live, but the energy is always live, isn't it?
Yeah.
It's always going on, but it's mindset. We don't like our minds to change. But one of the things that small things that we can do, since we all have to wash our hands all the time now, I like using soap because soap gives me an opportunity to practice mindfulness. And I think that that's something that's really important, that we, are mindful, because in this COVID time, we can get very scattered because we're worried, we're stressed, we're attempting to get things done, sometimes all at the same time. So one of the things is that in washing your hand is an opportunity for mindfulness, because you can, mentally begin to leave the stress and focus on what you are doing in the moment. So I say to myself, I am washing my hands. So I've left everything, behind. I'm washing my hands. I'm taking inhale and I'm inhaling through the mouth and exhaling through the nose. It's a small thing, but we wash our hands so often. These are opportunities where we can grab a bit of mindfulness and stress relief. Okay, so that's one of the things that I enjoy doing. Breath work is something you can do intermittently at any given time, but there are different techniques. It's one way to breathe, but there are different techniques. So some people like the 4-1-1, which is 4 breaths in through the nose and 1, 2, 3, 4 out of the mouth. So it's 4 in and 4 out. I said 4-1-1, right? Okay, so there's 4 in and 1 out. Just release. Sighing is a stress break. It is all, what do they call it? A sigh of relief. So 1, 2, 3, 4. Sigh of relief. Clear your head. Walking, if we can get out and get that vitamin D and take a walk at the same time, perfect. That's a great thing to do. Especially also with grief. So I'm looking at my little note that I wrote for myself, because accumulating grief, Dr. Rafik, as you were saying, it builds, it's in the emotions, it's in the brain, it's in the mind, and it's in the body. And you can be very tired and fatigued from grieving and stressing. And not that we shouldn't be. I've lost several relatives and friends during this time. And one of the things that I found to be helpful for me, because grieving can go on, they talk about 7 stages, and you can be in one stage for years. But in the midst of being present in the moment, it helps. Just being present for what's going on in the moment, helps. And and breathing, because as it builds up, hypertension builds up, the stress builds up, there's environmental anxiety, environmental, stressors, and they can accumulate to a prescription if we are not being mindful and paying attention. Even eating, if you're eating a lot of sugary foods, processed GMO foods, that can lead to anxiety and lack of sleep and a prescription if we aren't just being mindful and practicing self-care. So I like tapping, as I said before, and it's something that's easy that you can, connect with. And I'm excited. You can find it on YouTube. They have tapping for anxiety and stress. I've learned clinical tapping, so we go a step further, which they're not going to show you on YouTube. Thank you very much. You have to get with your practitioner for part 2. But you don't have to, you don't, can I demonstrate? Do I have time to?
Yeah, feel free.
Yeah.
Okay.
That'd be
So
great.
yeah, there's some basic steps, to it. And the truth is you can't get it wrong. All right. So it starts off with, you can do it this way, which some people like, or you can do it as a karate chop to the side of the, of your hand. Can you see it both ways?
Yeah.
Yeah, I can see it there. And then you have what we call a setup statement. So if you're saying to yourself, your setup statement is, oh, I'm so anxious. I have so much anxiety. I have a lot of anxiety. And from 0 to 10, let's say it's 10 and you want to come down to 0. So I have anxiety at a 10. I'm really stressed out. I do not know what to do. But even though I have this problem, I deeply and completely love and accept myself. Now, the words love and accept myself, people have a hard time sometimes saying that they love themselves. So you can say, I deeply and completely care about myself. Because what we want to do with anxiety and stress, that's not really diagnosable, but it's part of the everyday life and struggles, because we do have these struggles that make us feel as though things are out of order. It's to say that I'm having this anxiety and stress about COVID-19, about what's happening in my family, what's happening with me. But even though I have this, I myself, I deeply and completely love and accept myself. So that separates you from feeling that it's all in between your ears. Everything that's happening is real inside of your head, because that's where your story is. But the fact is that someone is ill, someone I know has passed, someone I know is struggling, someone I know has lost their home. Whatever these things are, they are experiences, but they are not you. So sometimes we live as though it's us. And so we get into our stories and we make the stories true. And then someone will come in and sit with me and say, I have all this anxiety and depression and all these things going on. And then they'll tell me what's going on. I'm saying, well, let's not diagnose that. Let's look at, this is an experience you're having. Let's see if it's real or not. Because sometimes, it's our story. So now we got the setup going, and we love and accept ourselves because we're okay, but we're experiencing something that's traumatizing us. So even though I have this situation, I deeply and completely love and accept myself, or I accept myself. And then we go here and we tap here. And what we're tapping on is the crown chakra, that little soft spot right at the top of the head. And this actually is what we call GV20, and it unlocks the whole body, this point. So this is a point. And from here, and you can tap till you're comfortable. Don't beat yourself in the head, but don't feather it. Yeah, give it a real, yeah, tap with me. Yes. And then we go, let me take off my glasses, and then we go in between what we call the third eye, and we tap in here, and even though I have this anxiety at a 10, I deeply and completely love and accept myself. And just breathe. Just remember to breathe with it. And so from the middle, from the third eye, you just go to the end of the brow. So when your eyebrow ends, this is the next point. I like to make it simple. People are like, am I in the right place? Wherever your eyebrow ends. And from the outer eyebrow all the way to the inner brow, there's a little bone right there, just so you don't get too close to poke yourself in the eye. And then from the inner eye to the top of the lip. All of these are chakra points, and all of these points reflect in the body and calms down the system. And then to the chin, and this tap, and even though this anxiety, at a 10, I deeply and completely love and accept myself, deeply and completely. And once you say it, you don't have to continue saying, but you can keep it in the forefront of your mind, depending on where you are. And then right here in the chest, there's a little indentation where the fingers just kind of sink right in. They sink right in. And you tap there in the sternum, and it's tender because there's a lot of accumulated stress there. And the acupuncture or acupressure right next to it, there's a lung points. And so they may be tender as well. And I like to get in here. So you can use the two, or you can do it this way. I like with both hands. I like to feel equal. So even though I have this anxiety, I deeply and completely love. And the last point is right at the broad line on the side. And for me, I just renamed this the flying chicken, because I feel like I'm just, in the yard like a chicken. But this is the last point right here. Right in here. And just take a breath afterwards. And just check in how you're feeling. So maybe you're at an 8 and you want to keep coming down. So you want to repeat it. You want to repeat it. And you may say anxiety and you may still feel, maybe you'll just feel a 9, but maybe it's not anxiety. Maybe you're disappointed. Maybe you're afraid because, you know, this thing is spreading. No one knows exactly how. Maybe I haven't washed my hands enough. Maybe you're starting to feel, you know, a little paranoid. So you want to tap on the feeling and that you resonate with, that's most, you know, up high for you. And I have found that has changed my life on many levels, and many people. There are millions of people, you know, who are, you know, now tapping. The tried and true always also is breath work. And when I finish tapping, I go straight into my favorite. Now, breathing through the nose and exhaling through the mouth is very effective, but I like in and out of the mouth, breathing from here, because by the time you're anxious and excited or even angry, you know it's right here, ready to come out, no control. Because this left the center and it came all the way up here and it's on its way out. So here in breath work, you want to inhale. It's really, if you look at an infant, this is how infants breathe. There is no pause in an infant's breath. It's circular breathing. It's also called conscious connected breathing. And it's also a rebirthing breath. And the reason why our breaths are so spaced apart, like, is because of the things that have taken our breath away in our life, that have made us sad. It takes our breath away and we get very shallow and the deep breath is gone. So inhaling bringing that breath, imagine from the bottom of your feet. So it's in and out through the mouth, and it's not an in and pause or out and pause. It is it's circular. It's a circular breath. Your mouth will get dry. You may feel a little distracted and concerned about that, but that's normal, and it will pass. And you may feel. I used to do this with felons. They wanted medication or drugs, and I'd say we're getting this free high off of the breath, and they got lightheaded, and they felt really, really good, because you will feel really, really good and centered doing this breath. Yes, it'll bring up, you know, a cough or clearing. It also lose a few pounds doing this breath. It breaks up stagnation. Yeah, it's amazing. It breaks up the stagnation. It's good for depression. And what's most important is that conscious connected breathing works on the cellular memory of the body. The cellular memory is everything that's ever happened to us collectively in the body is stored in the cellular memory. And breathing the way we normally do does not open up that door. It doesn't open up that channel. But conscious connected breathing, circular breath, opens it up. So maybe things you haven't thought about in a long time, you thought was over or you've gotten over it, but it comes up while you're doing the breath. It's not coming up to haunt you or to frighten you, but it is coming up to get released out of the body. So even though you may still have your story, you don't have the trigger or the emotion attached to it. And that's very important. Because when we live in that emotion and that trigger is on, we start re-experiencing trauma over and over and over again. So conscious connected breathing is one of my favorite modalities, and I am a certified breath worker. I started this journey with the Rebirthing Institute in Philadelphia and New York in 1996, and it has been amazing. And I've seen the transformation it has help people, and it's free. It's ours. It's our breath. So do we have any questions in the chat at this time?
We do.
All right.
So Cherry is asking the last chakra tap. Could you go over it again? She couldn't see where you were tapping.
Is it something blocking my? Let me see if I can put it up a little bit more. It's at the broad line.
The broad line, yeah.
Yeah, it's at the broad line. And at the broad line, you have different meridians that if you ever went to acupuncturist, you know, they would insert the needles in these particular points, you know, your liver, you know, and even stomach points are here, kidney. The body is like a subway map. It nerves cross and intersections, and this is a way of bringing it all together. And so is the breath work. All of these modalities were created long before we were here on the planet, and they've been brought back as what we call alternative health or complementary health now. But they are really powerful, and they really help you connect, because sometimes when we're in our head and we're experiencing stress and anxiety, we forget about the body. We forget we're in a body. We're just, you know, in our head, and we have to come from head into heart so that we can, you know, connect the dots. And so, of course, meditation is a powerful modality. Now, I'm not asking anyone to sit in a corner for an hour to meditate. You can start off, and if you have ADD or anything that takes your attention away, do that 1 minute. Quiet, just quiet. 5 minutes, great. Half an hour, great. Anytime, moment to moment. Small steps bring big results. Just a minute of quiet, a minute, 5 minutes of breath work. Doing it 20 times before you get out of bed, you know, or at night before you go to bed if you're having anxiety and sleeplessness. It really works. Give it an opportunity. And and one of the big things is, please stay hydrated. We're at home, we're not drinking enough water. We go to work, you know, we're not drinking enough water, but now you're at home and you're so busy and you're not drinking enough water. So even if you're taking the vitamins, they need to swim.
Yep.
Dr. Fig, I know you have a scientific way of explaining that, but they.
Well, you know, I
I
think that helped me quite a bit, because I agree with you. The shift also from mind, like, or more like cognition, like the thinking brain.
Yes.
And the fact that, you know, the news, the flashes, the information, the worry, all the thoughts, we're always in our head. And exactly
Right.
that, connecting more to heart center is how we heal.
Right.
And I agree. I think
Exactly.
that's really clear. And it was very helpful for me, because I immediately, in the beginning of the pandemic, when everyone was calling sick, it started to bring up that anxiety. And I found these daily techniques, whether it be EFT or breath work, just starting my day with that would allow me just to shift and be at least a little clear, so I could take on more. But if you're bringing so much of that on, it does crash somewhere. I mean, we're only at the limits, you know, and so you know, walking, you know, circulating and just being out. But even with the winter, this has been a rough winter. And I think isolation in general with elderly patients, you know, I just want to mention that also. Beyond that is that patients that already had dementia, their dementia got worse. And so I agree, like even these small techniques can really almost bring back a little bit of like a clarity for everybody. And one other great like forum has been all this online virtual work. Like there's been a lot of wonderful emailed practitioners offering all this kind of great holistic mindful work virtually. And so that's been a tremendous resource for patients. And I think also the, you know, as when people said a lot of grief, like so many people have discussed also, let's say if they were all exposed in an environment at work or others, that they really felt like a survivor guilt for why did they survive. That's like another element of it. But I also found like recently, and I agree, like I like that you said that, you know, you're new to this virtual plane also. You know, I also thought like, okay, so the breath work and the meditation is great because you can connect And then recently I reconnected with someone who was a sound healer and did like healing circle and sound bath. Like, and so I actually was in the space when we
Virtually.
did a meditation sound bath. And then just recently I connected with her on Clubhouse. In fact, she's a very gifted sound healer. And I have to say, having that sound bath experience with her, I told her, I said, you know, like 3 years ago when I saw you live, I felt like all of a sudden the tingling and my energy centers were open again. It's almost like she said, you know, she'll use different percussion and also like different types of rattles and things in the sound.
Yes.
And it's, she
Yeah,
said,
vibrates
you know,
with
our
different chakras. Yeah.
vibration, yeah, but also this magnetic field, right? Our body emanates a magnetic field, and it's our biofield. It's really relevant to how the chakras flow as well. That you know, having sound or vibrational healing is a way for the body to almost take it and be like spiritual loofah and clear out that
Yes.
field and kind of cleanse that energy. And I felt so light and so clear again after that loofah
Yes.
scrub. I said, yeah, it's just like scrubbing off dead skin and dead energy, you know, and just flowing again. You know, I think, you know, it's part of that understanding. And so there are so many wonderful you know, opportunities for people to also spiritually expand during this pandemic. Because, you know, instead of looking outward, we had to really
Yes.
go inward. And I think that's sometimes
In.
not a place people go because they have also a lot of you know, let's say there's unfinished work. So all of that comes
Yes,
up.
it's unfinished work. And it will
So I think,
always come up, you know, regardless of what they are saying consciously, the subconscious wins.
the
So it's still
subconscious,
there. So that inner work, yeah, and they don't want to go there. It could be
they don't
ugly
want
and
to go there.
terrible, but
Yeah. So I mean, some of that is
you're
a
not trying to
really,
heal while you're partying and having a good time.
you know, I think that's also a big thing, right? Some people really had to reevaluate the decisions they've made, the life, you know, and you know how they live, how to change really their thoughts around what's really important, what's really worth their time. I mean, because now we realize time is such a commodity. But you know, in general, I think as we talk about healing, I think a year not being humans out in the world, the world has healed, you know, and the earth and the climate has healed. So you know, maybe there's something to why this spiritually needed to happen, and we have to kind of look at the bigger why and maybe look at the benefits.
Absolutely.
I mean, so many other you know, as much of it has been a struggle, I think so many people have said like they've never spent such quality time with their kids, you know. In some
Absolutely.
ways they're like, you know, I used to, you know, not be able to have dinner with them. I would be working in the office till certain hours. So the
Right.
work life experience, you know, especially with school, I think that's a struggle. But, you know, if we think about the connections within the home, if there were that ability, it was almost like a blessing.
So much more powerful.
Yeah.
It was. It really was. Having the kids at home, a lot of parents didn't know, you know, that their children weren't really doing well in school. They didn't know whether they
Yeah.
were learning
Yeah.
or not learning, you know. And a lot of people, there were a couple of male patients of mine who, because of the pandemic and they were at home, they learned how to cook. They learn how to cook. Families start talking to each other again, you know,
Absolutely.
planning.
Absolutely.
Yeah. And
I think, yeah, in the course of this past year, I have a younger brother who's definitely 12 years my junior. And, you know, in some ways, it was the same issue. He would call me every few days about how to make this and how to do this, because he had to cook. And I agree with you. But it was a great way for us to rebond again as adults, and
yes.
definitely has enriched our relationship. So, you know, there's so many things that, you know, in the spectrum of the whole thing. I mean, I think we have to have gratitude to have, you know,
Absolutely. That's
come through
huge.
this experience, whether we have our scars with us, like we're going to come through this experience together in a way that's hopefully stronger and resilient. And I think we have to just, pray that, everyone finds the resources they need, because definitely there are people that are really suffering and, having food insecurity and, kind of a lot of complexities that, I think the purpose that we can provide for others also in this pandemic of volunteerism and being somewhat there for our community is another thing that had provided a lot of people resilience. I went to a food bank and
Right.
volunteered with my son, and we've helped a few pantries. But getting like the kids to also do that virtually, finding ways to help others and finding that they could be part of a solution rather than feeling so overwhelmed by what the experience was doing, but making
Very
it an
empowering.
opportunity for them to have their own small part. And when I met people just volunteering in the food bank, so many of them told me their stories about how they basically just came to this concept of doing the same because they had lost their job. They were not in even a borough that they were familiar with, but found different nonprofits to lend their commitment to and find a way to feel like they were doing something for everyone else, right? Or the activism around racial
Yeah.
issues. So many activism.
COVID-19,
raised a lot of
People are really bringing their stand to a forefront and being clear about honoring their commitment to their stand.
Yeah.
So
yeah, we're bringing humanity back. We're bringing the humanity back to the planet.
Yeah, no, I agree with
Yes,
you.
Mona?
Yeah, I say I agree with
Yeah,
you.
it's time for that, bringing humanity back. Yeah.
We saw a lot of, of pain, but also a lot of reprioritizing of, humanity and people coming together and being more human and allowing the planet to heal because we were destroying the planet. So I think,
We
we have.
We were.
I think a lot of people are regrouping and saying like all the issues, like, for me, I feel like, I've joined a few like clubs and Clubhouse that are looking at how can we change these problems in healthcare, and how can we change the conversation around education? Like, everybody's talking about going back to school, but how can school be more meaningful? Like how can we make all of these very important, health, welfare, and education, and all these issues? How can we get those be more of the priority in our society that we've kind of neglected? I mean, it's like nobody wants to solve these problems, but you can't. It just showed us that
we do now. We're talking about it.
We're
talking about it now. We are doing it. We are.
We had no choice. And this is how it becomes, I think, like in
and the
behavioral
are a great part of this.
Yeah, we have to.
The children are a great part of this because they're going to show us, because they've been at home, they've been looking, they've been wearing masks, they've been experiencing a lot of things that we have, but children keep it simple. They ask questions that we may not even have thought of at this time because we're so into the world in advance. But children, in their innocence, they will help us.
Yeah.
So this Generation Z and these millennials and all of us all together, because we're all here, we all need each other. I forgot what generation I think I'm baby boomer. Oh my Lord, yeah.
So I wanted to give our audience a chance to ask some questions. So feel free if you have any questions. I'm looking at the chat. I see there have been some comments. So do anyone have any questions or comments? Feel free to speak up. No?
I kind of wanted to just, since it's so interactive with Naila, it's nice to see you also, because, I think all of these, thoughts and questions, it's kind of like having a conference, like we used to talk about things.
Yeah.
We haven't been able
that.
to, but, I think a lot how, how suicide has gone up, and in particular in kids and teens. I think that's, I think, and in some of the cases, it's so difficult because of their isolationism has an impact on them so differently. And I just was happy to engage in one of these Brain Awareness Week conversations around the teen brain, which is very different than other brains. And since I have
Absolutely.
since I have two teens I'm dealing with, I realize now why I'm like, oh, okay, maybe that's why they're on the video game so much. I mean, it sometimes is like this outlet for their reward center,
Distracting the pain, distracting all that's
distract
going on.
the
It's too
pain.
much.
Yeah,
It's too much.
yeah, yeah.
And I, and then speaking to that, it's been so difficult. I'm so tired of them talking about mental health on television and so underfunding our
Yeah.
ability to be able to help our patients, because I spent a lot of time trying to find facilities where, attempted suicide or someone wanting to harm someone else because they think that everybody should leave because this is a sign from God that it's time to go. And instead of waiting for the world to end, I need to, to jump off now. It has been incredibly difficult getting, help. I mean, and
Yeah, yeah.
out of state, out of state, Pennsylvania and California are even willing to take some of our patients, but for 4 days.
Wow.
It's not enough.
They had a big legislation out in California discussing really also the policy changes that need to be in place. Like, I mean, in healthcare, we know there's a lot of healthcare issues, but there's also policy that has to change to adapt to this. Because like, as you said, all the insurers have a third party for mental health. And sometimes it's a real fractured system. And given like everything else was so cracked open, like telemedicine became available, mental health services should not, it almost needed to be funded, within the same construct of saying, okay, they're going to allow uninsured patients be covered through Medicare. Well, anybody with a mental health issue should definitely be covered, regardless of.
Absolutely.
And you know what, we have to cut that out because it's really what's really affecting our society from the bottom to the top. I mean, whether it's our seniors, whether it's our teens, whether it's our own, balancing life issues with families, especially women, I mean, women have such a hard time. And somebody told me, I really had this particular conversation just a few days ago that patient said, yeah, I know everything is virtual and she's insured. She has the ability to access care, but she says, I want to have a private conversation and I don't know where in the house I can do that. That's another problem, right? That's a real problem. Like, there's
people in their cars.
I said, people are in their closets, in their cars,
Yes, they are. Yes, they are.
Because
yes, they are.
That also requires like a real kind of like safe space to really air your real personal issues without your family around, like you really need to. So I think, policy has to change. I think we're well behind.
And for recently released people who were formerly incarcerated.
Yeah.
And they're coming out without any insurance and without any method to receive services. The appointments are 3 and 4 months away while you're episodic and you're having an episode. It's really it's sad. It has to be done about it. So these are the conversations that will change the system, because it has to change. It really does.
Yeah, I guess the more we bring awareness to these issues and these topics.
Even with obviously the most important thing, what we talked about was our nutrition and, what are we feeding and nourishing our mind, but not only our mind, but our gut, and where most of our immune system is, just to even access a proper nutrition evaluation and consult right now. I mean, it's just been a very difficult situation because it's not only about the weight gain, it's really about what's happening to their immunity, right? In the consequence, what have we sacrificed?
And we know that 70% of the immune system is in the gut, and the gut is the second brain of the body. So if what you're putting into your body, whatever you put in your body, is affecting the gut and it's affecting the brain simultaneously at the same time, and then you have reflux, and acid reflux, and you have pain, and then the stress of pain, causes depression because it takes a lot of energy to address pain, and it helps and it isolates us.
And then even with the nerves in the heart, like we talked about heart-centered, right? and
Yes.
all of heartbreak and fear and guilt, that heart as a muscle and as an
Muscle.
organ is almost like another brain. They
It gets
often
weak.
say. So it's
I
a
think
good
I think
idea
we have a question. Sorry to.
to focus. Yeah, let's try to answer someone that's live.
Oh,
Tamika, you
where is it?
mentioned there was a question.
Yeah, there was a question.
Yeah, I had a question. This is Gladys. Hey Naila, how you doing?
Hi, Gladys, glad you could join us.
Thank you. I know that there has been so much conversation about mental health. Like you said, I hear it all the time. Everybody speaks the words.
Right.
And you said that we need the help. But do you see with the change of administration, do you think it's an administration issue with the change of administration? Are you projecting that that help is going to come? Do you see that? And I think also there's a reliance on help that's all the way up here that never gets down to the person that needs the help. And if we don't get the help from up here, what can we continually do? And maybe even us who are not in that field of mental health kind of help kind of close the gap a little bit, not from we're the expert, but just in general as a population, how can we help close that gap until that help comes from up here? And do you think the help is going to come, or is it all just talk?
Well, I think that's a great question, Gladys. Really, a really good question. But yes, I do believe that help is on the way. But we also have to participate because in every state, city, and county, we have our local councilmen. We have a lot of local agencies that we don't support. We'll get out there, maybe we'll vote, in the larger election, but we have to participate at our local levels as well. And the more that is talked about, amongst people, I think the more help we'll receive. Mental health still has that stigma of, I'm not crazy, which, that type of language has always hurt the person because it's not about them being crazy. Mental health, without your mental health, there is no good health. The mind
Yeah.
is first. So I think that people talking more about, someone will tell you they have diabetic or, or they, oh my goodness, I had gonorrhea. Oh, wow. Oh, you got that penicillin. I mean, they'll talk about these kind of things easily, but mental health is like, who can I talk to? I feel so ashamed telling someone that I'm going through this. And so we have to all begin to talk about it more. We have to have more referral systems easily, that are easily accessible. So I think things like that would be very, very, very helpful because we can't just depend on it. Like you said, at the higher level, we have to work within our communities, our counties, our boroughs, and in our state,
Mhm.
back to back. So
Yeah.
anybody
Thank you.
else? I hope that was helpful.
Yeah, that was. Thank you.
Every state has a MAMI, a NAMI, which is the National Institution on Mental Health. Every state, and you're in Georgia, and so there's a lot of agencies coming out of the CDC and the National Institute of Health in Maryland, for people. But how do they know? How do they know? How to access this? So part of everyone's physical every year, they should do a mental health checkup. Just like now, they, how they enforced abuse, and violence.
Yeah, I think she froze.
Oh, we're freezing up.
Yeah, we're lost. I
It
think
was-
we lost somebody too.
Oh,
Excuse me?
Dr. Rafik, we lost her.
You froze, Naila.
Oh, am I back?
Yep, you're back.
Yeah.
Okay,
Yeah.
so we have also use a screening process when people come into the clinics. Begin to ask the mental health questions. In the hospitals when doctors are seeing children or people, instead of, I've been having anxiety, I can't sleep, I feel nervous, and you get a prescription for Xanax or all these different things. What about, how difficult has it been for you to go to sleep? What, have you ever had thoughts of harming yourself? Begin to do a screen. We need to do more. There are some simple things that we can do to bring this awareness to everyone. Oh, okay.
No, someone asked for our contact info.
Oh, okay.
Yeah, that was me. I didn't see that. And I think you had something else about another chart about contacting you or some program that each of you have or something.
The first 10, Myrna. The one of the
Oh,
first
yeah.
10 people.
Yeah, I
Oh,
didn't get a chance to see what that.
so yeah, we're having
We're bringing it back.
promo. Yes. So the first 10 people who, contact us, you will get a discount. Just mention this this webinar.
Okay.
This is what you're talking about, and then to
Yeah,
contact
and
us.
then the contact chart. And I'll
Yeah.
take a picture so I
and the
have it.
contact. So the contact, hold on.
And what I love about contacting you, Myrna, is that there are a lot of people who work with nutrition and weight loss, but you actually do the thing that people get crazy. Dr. Hyman wrote a book, What the Heck Do I Eat Now? You do
Yeah.
meal planning. And I
Yeah.
think that's so important because a lot of people are like, what are you going to get from eating salad every day of the week? You're going to lose some water, but you're not going to lose any weight, and you're not going to necessarily be healthy, but you can help people with what to eat and what's really good. All food may taste good, but it may not be, and it may be healthy, but it may not be good for you.
Yeah, so I mean, I focus on more of a holistic approach. It's not just the food, it's your mental health, it's your physical health, your environment, everything is interconnected, which is why I love working with you guys, because we bring all of that together. And I wanted to
Yes.
mention that Dr. Afik, I'm gonna mention your podcast because
Oh,
Oh, when does it start?
I'm literally like embarking on this right now. It's exciting. It's really exciting. I am using Anchor, which is an option on Spotify. It's very simple to use. I think with all of this, just having so many conversations and thoughts, like I found that, using an audio, which has now become such a great way for people to engage in either audio books. I find that it's a great way just to share the story of how I am, kind of how I became in this integrative model, like a holistic practitioner and a healer, and what my personal story was with cancer, and how my own child's diagnosis with autism, he's neurodiverse, and how I found the holistic tools to help me balance all those same issues that I think a lot of women are balancing, like finding solutions for their family and supporting my own health and well-being while I'm helping to really help so many others. So I think it just seemed more than ever to be a time to really kind of share that. And so Anchor has got a great platform. I'm just trying to figure out my background music and just start a trailer and map out my season. So it'll be called The Path of the Healer, because I feel like that's what I've done. Is once you embark on that journey as a healer, it's almost like it's shown to you, like you just follow it and get guided by faith. So it's really led me in the way that I really am so grateful to practice, and find it as such a rewarding experience compared to years before in healthcare. I feel like I'm actually really helping people on a deeper level. So thank you, Myrna, for the promotion. I'm just happy to be able to share.
Awesome.
And I think it's also a great time for people to use these tools. They're really self-publishing, or making their own audio, and just being able to journal or unleash. That's another great tool to be cathartic in the process of healing.
Yes.
So I think I really encourage everybody to, do the same. So I appreciate it. Thank you. And thank you for inviting us
that,
and coordinating this. Yeah.
Yeah. Have you all found that the healthcare insurance industry has caught up with this, I don't want to say it's a concept because I think it's real, of holistic medicine?
I would think
the insurance is helping to help get us in, who wants to come into that world versus paying for the regular physician that we have today?
I would say
I-
they're working towards it, but they haven't caught up. I mean, like some like employers now offer like a health and wellness,
I think,
option
yeah.
with some insurance, but not all. So I think that it's in progress, but I don't think they're
I
fully
think,
there.
yeah, I think what biggest issues that drive policy change, and I have a background in this health policy and management, it's, there's a lot of data there. The problem is, implementing a policy change at a structural level with insurance. They want to see large population-based studies in a way that traditional medicine is designed. So anecdotally, we know certain phytochemicals and botanicals, and we know about plant-based diet. There's been a lot of data, for many years about heart disease and other issues, but they're slow to change this progress because, I think it's coming to a real, it's going to come to a head right now because there's no way to sustain the healthcare system with cost. Because what is really clear from a holistic perspective, that's where the prevention is, right? On a holistic side, we've been so busy that the whole healthcare system has really been adapted to chronic disease management. So that mindset has to change.
Exactly.
And then they can support
Exactly.
and then they can support and fund it. I think a lot of research is still something we should probably try to do. I think it only feels like now in pain management, because that became such a hot topic, uh, oncology, cancer, of course, a lot of cancer places like Cancer Treatment Centers of America, they offer holistic modalities within their model. But, it's not that the health insurance has changed. It's sometimes centers have adapted. And then probably, very small touches of that within other like umbrellas. But I do think like even the use of psychedelics now in mental health. I mean, NYU is opening a psychedelic medicine department to study using mushrooms in a way that may adapt and change how many long-term addictions and traumas translate in the brain. And so
Very
I think
powerful.
it's a real powerful time for change. And I'm hopeful that, we've not lost it yet. A lot of employers have to see that it's going to save them their bottom line.
Yeah.
And, I think that the insurance system is still trying to hold off on making these changes, but they can't avoid it. I think a lot of people don't have the flexible spending plans and things to maybe use towards their holistic plans, right? Their plans to
No,
incorporate other things. And that would also be a great model, right? Just
depends on the
give me the dollars out of my insurance instead of making me pay for a co-insurance to do what? I mean, pay me to be healthy, and maybe that's a good thing.
Well, that's what
And
they've
I'll
done
avoid the
in
risk.
Japan. Pay
Yeah.
you to stay healthy. When you get sick, then you don't pay. So another thing is that 2010, we remember those projects. I was on a project called Healthy People,
Yeah.
2010,
Yeah.
2020.
Yeah.
But
Yeah.
but that's geared to welfare recipients, people that are poor, instead of addressing the whole nation as being healthy. So the small changes they made there was that for people who use that particular system and receive those benefits, that they will pay for some of the plant-based foods and some of the healthier foods. But that's just limited to people who are nursing mothers, mothers who are breastfeeding to a certain point, but it should be for the overall, overall health. The employees assistant program may allow you 6 or 10 visits, and they don't really want to pay very, pay very well.
And I think the other very big point of insurance being attached, I mean, we're the only country in the world where we only have insurance as a consequence of our employment. Well, what do we do now? We have 10 to 12 million people uninsured. I mean, we can't have a system that's all based on that. And, that's where the fracture is, because there's so many stakeholders that aren't patients and physicians who are struggling to provide those health needs, but employers have their needs, and health plans want their best return on their investment. Hospitals are still considered hotels. I mean, they want their beds full. You know, so it's a little consequence of really changing how things are compensated. And it's time to change that. So
Yeah.
I thank you for that really very intuitive
That's-
question. It's really going to take
Yes.
a lot of political change at a big level. And I think also they really looked at in certain for formats like the functional holistic practices that supported people virtually with a lot of you know, immune system activation as rejuvenation or more precision medicine approaches really did well during this pandemic, because that's what people needed to get better and to also prevent getting sick beyond the social distancing and masks. Whether they really kind of recovered, I think was a great you know, kind of spotlight on how integrative holistic medicine can provide that kind of support during a pandemic is exactly the example, the big example that we all needed.
Yeah, thank you for that sharing.
Yeah, thank
So
you.
at every level, this, you know, this has to change. Another thing is that now, so speaking of insurance, all employers have to have insurance for their employees, but they also have backup insurance. So now we're spending more than $30 billion on employee absenteeism and other situations. Here's an employee that's working every day, and the cost of their health insurance has risen. And if they have a deductible and that deductible is not paid, then the provider, like myself, is not paid. So therefore, now we have a whole slew of providers who are not even taking insurance because it's too problematic getting paid. But if you have an employee that's working for you and they have a deductible, why not allow them to be seen? They're still working for you. So the system is twisted from the top to the bottom.
Yeah.
And it really does,
And you know,
because,
that is a challenge. I mean, you know what, that is definitely true that, you know, practitioners find that the struggles with getting paid for their services far outweigh and requiring administrative costs to chase it all, you know, is also, you know, an issue, so that people, you know, often require or want their payment upfront and ask people to reimburse from their own insurance later. And that's been a model, but you know, it's really been limiting for people. The access is very limited. So, you know, it's a big conversation. I think, like we said, everything is gotten cracked open with this pandemic, and it's really a time to re-envision a future that is different. A future has to be different. It can't go on like this, right? It's just unsustainable. Well, thank you so much, Myrna. I think this was such a great and appropriate conversation on the right weekend and on the right day. So it's just, it was really wonderful. Yeah.
Thank you guys for participating, and thank you everyone for
so much,
attending.
Myrna.
Yeah, so I will actually, this is being recorded, and I will send out the recording. So we need to do more of these workshops, so you know, to bring awareness. Okay.
Yeah, I think we should probably think about, again, I think we were talking about even the frontline workers and their experience. It'd be an interesting thing to focus on too.
Yeah.
Because they really, the trauma that they experience firsthand is something that is very unique. So
yeah, and I would just say that me, the public, the non-expert, we are learning about this, right? Because it's not how we grew up. And so I think it's so important. I think we're wanting to be more aware now. We want to have more information. We want to look at alternatives. And so something like this and doing things like this gives us enlightenment so that we can do our little part to see the change that we want and be the change that we want to see out there. So I appreciate, Nyla, thank you for inviting me. I was really looking forward to listening to this, and it was worth it.
Thank you. I appreciate it. And, you know, and thank you for, you know, for your questions. These are the questions that we all need to ask in our local, you know, and state government, in our hospitals, everywhere. We need to have this conversation. Thank you. Myrna, thank you so much.
Okay.
Thank you, Myrna. Okay.
Dr.
Have
McPhee,
a-
good to see you all. Oh, I miss being
And
in the office.
yeah, everybody do your
rest of your day.
EFTs and breath work and meditate on World Meditation Day. And, you know, like just take a nice sigh of relief, right?
Yeah.